World Health Organization defines rare diseases as those that affect fewer than 65 people per 1,000 individuals and can be caused by a number of factors including genetics, infections and allergies. Rare diseases can cause a lot of distress to both the patients and caregivers because in most cases they are misdiagnosed, making treatment difficult.
We have few cases. First of all, you need to do an epidemiological study to find out how many of these such patients do we have in our population so that we can provide a budget line for their medicines or health care. But if at all you have got the professionals who can fix their problem, that will be a very good thing. But should there be no professionals who can handle it, then the medical board should decide to transfer that patient to centers where they can get treatment better, maybe in the and pay for them.
Parents with children who have rare diseases recount the challenges they have gone through. Lung Sesimbwa has a child with Duchenne muscular dystrophy, while Alfred Omawire has a child with amelogenesis.
In the year 2019, we had a child and he was making 3 years and he was struggling to pick up with movement and his eyes looked like he wasn't developing as normal, but mainly movement. Everyone could see that he's struggling to squat and he's struggling to go up the ladders. So one of the teachers, who is teacher Esther, who was his teacher, insisted to us that we go on and take some checkups. It brought some bit of a worry, but we finally started out on a journey to go to the hospital to find out. The first meeting with the doctor that we met, the doctor encouraged more movement for the child and said we come back after 1 year for the checkup. But this was not something that, it was something that was eating us up because we could tell that something is wrong and no one is able to tell. So we moved to a number of health facilities and finally we found one, we were referred to one neurologist who was able to diagnose a child with Duchenne muscular dystrophy, a condition that is so painful as they introduce to you as a parent, because when you give birth to this child, the child looks normal and you're expecting good progress, only to tell you that he has an ailment that is going to be wasting away his muscles as he grows up, and it's such a pain.
The teeth she kept on losing teeth. Pieces of teeth could just come, so in most cases when she wakes up, and she could throw them. But we consulted more doctors, people. We thought she could come out of it. But later on we realized she had grown and it was not easy. So we contacted some dentists and they recommended that she goes for better medical management. She did a scan from Kampala, same advice came out. She went to Nairobi, she did a scan, same advice. But the costs were varying. Then she had to consult some doctors who advised her also to seek medical support or surgery from Turkey. Turkey was the cheapest because considering even the air tickets, and we were going to take a short time, like 1 week, while Uganda was going to take like 3 months, and she could not get all the surgery in one medical facility. She had to go to one hospital, go and see another doctor, and that was going to take 3 months. Then also Nairobi was going to take 1 month. We took a decision that she goes to Turkey. It has been a very bad and a terrible experience.
So how is she now?
She has had the first phase of the surgery in Turkey, where they have had to replace all the teeth. They had to put the root canals, and her gum used to have a lot of problems. She's now okay, she has a smile.
Duchenne muscular dystrophy is a genetic disease that causes progressive muscle weakness and wasting, while amelogenesis imperfecta is a congenital disorder that presents with rare abnormal formation of the enamel or external layers of the crown of the teeth.
Muscle dystrophy,
and the journey that I've moved along with this condition is quite emotionally draining. However, I'll just be brief. Talk about how I was almost refused an admission because they thought I could not handle the profession. However, I had made it on merit. I had a government scholarship directly from my high school to university to do this program, and I did the program successfully, completed. I went to Zambia for internship. I did internship successfully. However, because of the condition getting worse and worsening, I'm no longer involved actively in practice, actively in clinical practice, because of the degeneration that I have undergone and a significant weakness I have suffered. But now I would consider it a risk to the patient and to myself if I'm doing being involved directly in day-to-day clinical practice and treatment of patients. So I no longer do that because I have gotten significantly weaker compared to when I was doing internship or when I was training as a medical doctor.
This is a condition that is inherited. The boys get it from the mother. It's X-linked, and as we all know that mothers have 2 X's and fathers have 1 X and a Y, so the boys will get the X from the mother, so they will pick this gene usually from the mothers. So what will happen, you may not know this baby is born or boy is born normally, develops okay. In some they could have delayed in walking and even delay in talking. However, as time goes on, you'll find that they will have delay in walking, running is becoming the problem. They trip while running, while walking, and eventually they start coming in. Actually, retrospectively, the parents may not know, may think that this child is just making up things. But with time, you find these children start failing to walk. They progressively get muscle weakness, and they'll have big calves, and then they are unable even to comb their hair because the limb girdle, the muscles within the girdles, either the shoulder girdle, the hip girdle, are very weak.
Members of Parliament on the Health Committee and the civil society organizations are now advocating for a budget line to cater for people with rare diseases.
Training of health workers who can recognize some of those diseases when they find them in the population, not just training our healthcare providers on common diseases, but also those diseases which we find in other populations, fugue, dengue fever, and so on. Even those diseases that had been here before and they are no longer a threat to our communities. We need to have those kind of training so that people can recognize them. Once they are recognized, then we can say certain types of diseases require certain types of importation of drugs. It doesn't matter how many they are, as long as they're there. We need to recognize them. But few medical workers may be in position to recognize some of these rare diseases. Hemophilia, for instance. Hemophilia is not so common, but when it is there, it is in the population. Maybe 1% of the population has hemophilia. Many of them die because of lack of diagnosis. Their diseases have not been recognized. They bleed to death, and so on. So,
however, there are some of those rare cases of where we have rare diseases that really affect a few individuals and cause catastrophic expenditures in trying to manage them. However, we still feel that every human being, every Ugandan, it's the mandate of government to ensure that they are all treated. So even if it's an isolated case, that one life matters, and government should be responsible in also catering for those isolated cases and ensuring that people get full access to health care.
The lives of people with rare diseases can be improved by raising awareness, improving diagnosis, enhancing access to care and treatment, and fostering research and development of therapies. Adia Nakote, UBC.